So we are talking about chapter 12, the endocrine system. This is the anatomy and physiology class. Let's continue the PowerPoint in the slide 16. Again, we are talking about the anterior pituitary gland and the hormones that are released from this gland. The follicle stimulating hormone is FSH is released to stimulate ovarian follicle development in the female, stimulate sperm cell production in the males. Continuing with more hormones released by the anterior pituitary gland. Here we have the luteinizing hormone LH that in females stimulate ovulation and progesterone production, and in males testosterone production. Also stimulate lactogenic hormone prolactin. Well, we have the lactogenic hormone prolactin. This is another hormone that stimulate milk production in females, may cause decrease in male sex hormones. The posterior, we were talking about the anterior and all the hormones produced in the anterior pituitary gland. Let me mention again which one are all the hormones produced in the anterior pituitary gland. In the anterior pituitary gland, we have the growth hormone GH, the thyroid stimulating hormone TSH, the adrenocorticotropic hormone ACTH, the melanocyte stimulating hormone MSH, the follicle stimulating hormone FSH, the luteinizing hormone LH, and the lactogenic hormone or prolactin. Now let's talk about the posterior pituitary gland and its hormones. Remember that the hormones that are released by the posterior pituitary gland are produced first in the hypothalamus. It's the hypothalamus that produces these hormones. The antidiuretic hormone ADH and the oxytocin are produced in the hypothalamus, are sent through a duct to the posterior pituitary gland, and then are released to the blood torrent through the blood vessels. But for the anterior pituitary gland, the one that we were studying, all these hormones that I mentioned, the anterior pituitary gland produce these hormones right there. The hypothalamus only regulates. So the hypothalamus don't produce all this long list of hormones of the anterior pituitary gland. Just serves like works as the brain of the operation. So in the posterior pituitary gland, we have the antidiuretic hormone ADH again that increase water reabsorption in kidney tubules. The deficiency results in diabetes insipidus, regulated through osmoreceptors for dehydration that causes water conservation. So everything about water in the body is regulated by the antidiuretic hormone. The other hormone produced or secreted by the posterior pituitary gland, remember, are produced in the hypothalamus but are secreted through the posterior pituitary gland, is the oxytocin that again helps in the contraction or works in the contraction of uterine smooth muscles, constriction of mammary gland cells for lactation, and given after childbirth to constrict blood vessels to minimize the risk of hemorrhage. The posterior pituitary gland and its hormones. Again, we have here the hypothalamus in the center of the brain. It's just a structure in the brain, a mass in the brain that is the control master for the pituitary gland. So we have the hypothalamus that controls the pituitary gland. Again, this is the posterior lobe of the pituitary gland, and the hypothalamus create and produce oxytocin and ADH, send it through ducts to the posterior pituitary gland, and send these hormones from the posterior lobe of the pituitary gland through the blood vessels to the blood torrent to stimulate. We mentioned what the oxytocin stimulates and the ADH. ADH hydration and oxytocin contraction of the uterus, contraction of the mammary glands. And then we have here the anterior lobe of the pituitary gland, that is the one that produces this long list of hormones, the growth hormone, LH, FSH, it's a long list. Then the releasing of the hormones produced here are just controlled by the hypothalamus. As I mentioned before, is the brain center that controls everything about releasing hormones. Now this picture belongs here. The thyroid gland, its hormones and some disorders. The thyroid gland is located, this one has two lobes. It's located below the larynx on either side of the trachea. Requires iodine for functioning well. The thyroid gland, its hormones. Remember, iodine, you can get iodine in salt with iodine. That's a good way to ingesting this mineral. The thyroid gland and its hormones and some disorders. Well, the thyroid produces the hormones thyroxine, T4, that works for metabolism, the 3-iodothionine or T3 that also works in metabolism, and the calcitonin hormone that have the regulation of calcium and phosphate concentration. So it regulates calcium, regulates the calcium that is used in the bones. The thyroid gland and its hormones and some disorders. Continuing with this, hypothyroidism is one of the consequences is cretinism. You have a lower metabolic rate and myxedema. Hypothyroidism, hyperthyroidism is an elevated metabolism. You can develop gray disease and exophthalmia, like big eyes. The parathyroid glands, their hormones and some disorders. The parathyroid glands are four bean-shaped glands that are encrusted in the thyroid. They are located within the posterior thyroid gland. Chief cells secrete parathormone, PTH. PTH stimulates bone cell release of calcium and phosphate. Hyperparathyroidism can produce breakdown of bone matrix. Hypoparathyroidism, a low level of the parathyroid hormone, can create a low calcium level in the blood. Here are, it's difficult to see them in this picture because of the color. It's difficult to differentiate, but here are the position of the parathyroid gland. Here you can see these four small dots. These are the parathyroid glands, but they have even if they are so tiny, they have an important function. Now let's talk about the adrenal glands, their hormones and some disorders. These glands are located on the top of each kidney. You have the adrenal medulla that produces epinephrine and norepinephrine. The adrenal cortex produces aldosterone, cortisol, and androgens. So all these hormones are produced in the adrenal glands. The adrenal glands, some disorders are Addison disease, that is a lack of adrenal cortex hormones. Cushing syndrome, that is too much adrenal cortex hormones. Another gland is the pancreas. The pancreas, in the structure of the pancreas called the islets of Langerhans, you have located the beta cells that have the function of insulin production, and alpha cells that produce glucagon. The blood glucose levels are regulated by a negative feedback of glucagon and insulin, trying to maintain a balance in glucose in the blood. Disorders of the pancreas, low blood glucose that produce acidosis and can kill you. High blood glucose, that is an excess kidney production and dehydration. They cause all this. Diabetes mellitus, that is an insufficient insulin production, and you know the disease of diabetes, how many complications you have. The glucose level goes. For being diagnosed with diabetes, you need to have fasting. When you're fasting, your glucose level should be higher than 100. If it's between 100 and 125 milligram per deciliter, you are pre-diabetic. If you have more than 125 fasting, that means you are diabetic. But after eating, so non-fasting, your glucose level should be less than 200 milligram per deciliter. If you have a higher level than 200, then you can be diagnosed with diabetes.
Is 80 a normal level?
80, yes, because
80.
the normal glucose level is from 60 to 100.
Because my protocol is that when a patient has 80 glucose level, we have to give glucose because they considered hypoglycemic. But if it's normal, I don't know why we have to. That's weird.
And where you have this protocol?
EMS.
Oh, but the thing is, that parameter is when the patient is fasting or non-fasting.
No, like just regular, non-fasting.
Well, if it's non-fasting, that could be a good protocol. But the normal range fasting is 60 to 100. So if it's
Okay.
not fasting, like 80 is a good parameter. Just the thing, if you have 80 milligram per deciliter non-fasting, and the patient has symptoms of
AMS and stuff like that.
low glucose, then you can provide glucose. But if the patient has 80 and don't have any symptoms,
Oh, okay.
so you have to play with the symptoms and the values too.
Well, yeah, but sometimes, well, I mean, yeah, it makes sense because our protocol we have to give it if the patient is showing signs of AMS and stuff like that.
Yeah. couldn't find the range in Google. That's so weird. Normal range. Well, another parameter is the A1C hemoglobin that needs to be between 5.7 and 6.4 to be normal. Well, here you have a reference for adults before meal. 70 to 130 is kind of the normal fasting. But again, it depends on the symptoms of the patient. So we have all these disorders of the pancreas. Then we have the testes and ovaries, that the testes produce testosterone hormone that helps in the development of male reproduction structures and development of male sex characteristics, and the ovaries that produce estrogen and progesterone, and they rule the development of female reproductive organs, development of female sex characteristics, and control the menstrual cycle. The thymus gland, located in the chest, and its hormones, is located behind the sternum bone, secretes thymosin, important for T cell production, T lymphocytes for defense of the body. These are white blood cells, and the thymus shrink as we age. The pineal gland and its hormone. The pineal gland is located in the brain near the thalamus. Produce melatonin that inhibits the reproductive functions, regulates body rhythms. The serotonin is a neurotransmitter and vasoconstrictor, stimulates smooth muscle contractions. So these are the hormones of the pineal gland. The pineal gland and its hormones. The pineal gland is located here, right here. This structure here near the back of the brain, on top of the cerebellum, next to the cerebellum, next to the thalamus. This structure is the pineal gland. Here we have a short summary where we can see all that we discussed today. Discuss the function of hormones, classify hormones into their major chemical categories, describe how the hypothalamus controls the endocrine system, and name the major endocrine glands, and describe the effects of their hormones on the body. This was chapter 12, the endocrine system. Now I'm gonna stop the recording to continue with the next chapter, that is chapter 13, about the blood, okay?